Every time you visit the doctor, someone wraps that cuff around your arm, pumps it up, and then reads off two numbers: 140 over 90, 120 over 80, 135 over 85. You nod like you understand what those numbers mean. Maybe you even write them down. But if I asked you right now which number is more important or what those numbers actually tell you about your health, could you answer confidently? Most people can't, and I don't blame them. For something so fundamental to our health, blood pressure is poorly explained. Doctors are busy, appointments are short, and somehow this basic information falls through the cracks. So today, I'm going to explain blood pressure in a way that actually makes sense. By the end of this video, you'll understand exactly what those two numbers mean, which one matters more at different ages, what ranges are considered healthy versus concerning, and how to get accurate readings at home. This is information everyone should have, especially if you're over 60, because blood pressure becomes increasingly important as we age. Understanding your numbers is the first step toward managing them. Let's start at the very beginning. Your heart is a pump. That's really all it is, a muscular pump about the size of your fist sitting slightly left of center in your chest, beating roughly 100,000 times every single day. With each beat, your heart squeezes and pushes blood out into your arteries. That blood carries oxygen and nutrients to every cell in your body, from your brain to your toes. Then it returns to your heart, gets pumped to your lungs to pick up fresh oxygen, and the cycle repeats. Blood pressure is simply the force that blood exerts against the walls of your arteries as it flows through them. Think of it like water pressure in a garden hose. Turn the faucet up, and the water pushes harder against the hose walls. Turn it down, and the pressure decreases. Your blood pressure works similarly. Sometimes the pressure is higher, sometimes lower, and those fluctuations are normal throughout the day. But when the pressure stays too high for too long, it damages those artery walls, and that damage leads to serious problems we'll discuss shortly. Now here's where those two numbers come in. When the nurse tells you your blood pressure is 130 over 85, she's giving you two distinct measurements. The top number is called systolic pressure. Systolic comes from the Greek word for contraction. This number measures the pressure in your arteries at the moment your heart beats, when it contracts and pushes blood out. This is the maximum pressure your arteries experience, the peak of each heartbeat. The bottom number is called diastolic pressure. Diastolic comes from the Greek word for relaxation. This number measures the pressure in your arteries between heartbeats, when your heart is resting and refilling with blood. So when your reading is 130 over 85, it means the pressure peaks at 130 when your heart beats and drops to 85 when your heart rests. Both numbers are measured in millimeters of mercury, abbreviated as mmHg. This unit dates back to the original blood pressure devices that used mercury columns to measure pressure. We still use the same unit today, even though most devices are now digital. Let me give you an analogy that might help this stick. Imagine a wave pool. The waves come in regular intervals, rising and falling. The systolic pressure is like the height of each wave at its peak. The diastolic pressure is like the water level in the trough between waves. If the waves are too powerful, too high, they can damage the pool walls over time. The same is true for your arteries when blood pressure stays elevated. Now that you understand what the numbers mean, let's talk about what's considered healthy. The American Heart Association provides the following guidelines for adults. Normal blood pressure is defined as systolic below 120 and diastolic below 80. When someone says the ideal is 120 over 80, they're really saying below those numbers. Elevated blood pressure is systolic between 120 and 129, with diastolic still below 80. This is a warning zone. Your pressure is creeping up, and lifestyle changes now can prevent it from getting worse. High blood pressure stage 1 is systolic 130 to 139 or diastolic between 80 and 89. Notice that either number being elevated puts you in this category. At this stage, doctors typically recommend lifestyle changes and may consider medication depending on your overall cardiovascular risk.
High blood pressure stage 2 is systolic 140 or higher, or diastolic 90 or higher. This is where medication is typically recommended, along with lifestyle modifications. Hypertensive crisis is systolic 180 or higher, or diastolic 120 or higher. This is a medical emergency. If you see these numbers and are experiencing symptoms like chest pain, shortness of breath, or neurological changes, call 911 immediately. Let me repeat these numbers because they're important. Normal is below 120 over 80. Elevated is 120 to 129 over less than 80. Stage 1 high blood pressure is 130 to 139 over 80 to 89. Stage 2 high blood pressure is 140 or higher over 90 or higher. Crisis is above 180 over 120. Now, these guidelines were updated in 2017. Before that update, 135 over 85 was considered the threshold for high blood pressure. So if you were told years ago that your blood pressure was fine at 135 over 85, understand that current guidelines would classify that as stage 1 hypertension. This is why regular checkups matter. Guidelines change as research improves our understanding.
Here's a question I hear frequently. Which number is more important, systolic or diastolic? The answer depends somewhat on your age. For adults under 50 or so, diastolic pressure, the bottom number, is often considered a more significant risk factor for heart disease. Elevated diastolic pressure in younger adults correlates strongly with future cardiovascular problems. However, as we age, the situation shifts. After about age 50 or 60, systolic pressure, the top number, becomes increasingly important. This is because our arteries naturally become stiffer with age. Stiff arteries don't expand as easily when the heart pumps, so systolic pressure tends to rise. At the same time, diastolic pressure often stays the same or even decreases. This is why you'll see many older adults with readings like 160 over 70, high systolic but normal diastolic. This pattern is called isolated systolic hypertension, and it's extremely common in adults over 65. Research consistently shows that elevated systolic pressure is the stronger predictor of heart attack, stroke, and kidney disease in older populations. So if you're over 60, pay particular attention to that top number. But I want to be clear about something. Both numbers matter. If either number is elevated, it needs attention. Don't dismiss a high diastolic reading just because you're older, or ignore a high systolic reading because you've heard diastolic matters more. Work with your doctor to address whatever is elevated in your specific situation. Now let's talk about why high blood pressure is such a big deal. High blood pressure is often called the silent killer, and that name is accurate. Most people with high blood pressure feel completely fine. There's no pain, there's no obvious symptom. You could have dangerously elevated blood pressure right now and have no idea. But just because you can't feel it doesn't mean it isn't causing damage. Think about what happens when pressure is too high inside a pipe for years. The pipe walls get stressed, they develop weak points, they become damaged. Your arteries respond similarly to chronic high pressure. The constant force damages the inner lining of your arteries, called the endothelium. This damage triggers inflammation and allows cholesterol and other substances to build up, forming plaques. These plaques narrow your arteries, reducing blood flow. Worse, these plaques can rupture. When that happens, blood clots form on the rupture site. If a clot blocks blood flow to your heart, that's a heart attack. If it blocks blood flow to your brain, that's a stroke. High blood pressure also forces your heart to work harder. Over time, this extra workload causes the heart muscle to thicken and become less efficient. This can lead to heart failure, where your heart can't pump blood effectively enough to meet your body's needs. Your kidneys are also vulnerable. They rely on healthy blood vessels to filter waste from your blood. High blood pressure damages those vessels, potentially leading to kidney disease or kidney failure.
Your eyes have delicate blood vessels that can be damaged, potentially causing vision problems or blindness. Even your brain suffers. Chronic high blood pressure is linked to cognitive decline, vascular dementia, and increased stroke risk. All of this damage accumulates silently over the years, which is why catching high blood pressure early and managing it properly is so important. At this point, you might be wondering what causes blood pressure to be high in the first place. In about 90 to 95% of cases, there's no single identifiable cause. This is called primary or essential hypertension. It develops gradually over the years, influenced by a combination of factors, including genetics, age, diet, weight, activity level, and other lifestyle factors. In the remaining 5 to 10% of cases, high blood pressure is caused by an underlying condition. This is called secondary hypertension. Causes can include kidney disease, thyroid problems, sleep apnea, certain medications, adrenal gland tumors, and other conditions. Secondary hypertension often comes on more suddenly and causes higher pressures than primary hypertension. If your blood pressure suddenly becomes severely elevated, or if it doesn't respond well to medications, your doctor may investigate underlying causes. But for most people, though, high blood pressure results from a combination of factors that accumulate over time. The good news is that many of these factors are modifiable. Diet, exercise, weight, alcohol consumption, and smoking all influence blood pressure and are within your control to change. Now I want to address something important. Blood pressure fluctuates throughout the day. This is completely normal. Your blood pressure is naturally lower when you're relaxed or sleeping. It rises when you're active, stressed, or consuming caffeine. It can even rise when you're in a medical setting, a phenomenon called white coat hypertension. A single elevated reading doesn't necessarily mean you have high blood pressure. Diagnosis is based on multiple readings taken on different occasions. This is why measuring blood pressure at home has become increasingly recommended. Home monitoring gives you and your doctor a much more complete picture of your blood pressure patterns. Let me explain how to measure blood pressure accurately at home, because technique matters enormously.
First, choose the right device. Upper arm monitors are generally more accurate than wrist monitors. Look for a device that's been validated for accuracy. The American Heart Association and other organizations maintain lists of validated monitors. Make sure the cuff fits properly. A cuff that's too small will give falsely high readings. A cuff that's too large will give falsely low readings. Most monitors come with medium-sized cuffs that fit arms between about 9 and 13 inches in circumference. If your arm is larger or smaller, you may need a different cuff size. Now, here's the proper technique. These steps matter more than people realize. Don't measure blood pressure right after exercising, smoking, or consuming caffeine. Wait at least 30 minutes. Empty your bladder before measuring. A full bladder can raise blood pressure. Sit quietly for 5 minutes before taking a reading. Don't check your phone or watch TV. Just sit. Sit with your back supported against a chair. Your feet should be flat on the floor, not crossed. Unsupported backs and crossed legs both artificially raise blood pressure. Rest your arm on a flat surface like a table, with your upper arm at heart level. If your arm is hanging at your side or raised above heart level, your reading will be inaccurate. Place the cuff on bare skin, not over clothing. Position it so the bottom edge is about an inch above your elbow crease. Stay still and don't talk while the measurement is being taken. Take 2 readings about 1 to 2 minutes apart and record both. Blood pressure can vary from reading to reading, so multiple measurements give a more accurate picture. Measure at consistent times each day. Many people check in the morning before medications and in the evening. Consistency helps you track patterns. Record your readings in a log, whether that's on paper or in an app. Bring this log to your doctor's appointments. One more thing about home monitoring. Don't become obsessive. Some people check their blood pressure 10 times a day and worry about every fluctuation. This anxiety can actually raise blood pressure.
Checking once or twice a day at consistent times is plenty for most people. If your doctor has asked for more frequent monitoring for a specific reason, follow their guidance, but otherwise, obsessive checking creates more stress than benefit. Let me address a common question. What should you do if your blood pressure is elevated? If you take a reading at home and it's elevated, don't panic. Remember that single readings don't define your blood pressure status. Take another reading after resting a few more minutes. If it's consistently elevated over multiple readings on different days, schedule an appointment with your doctor to discuss it. If it's extremely elevated, above 180 systolic or above 120 diastolic, and you're experiencing symptoms like severe headache, chest pain, shortness of breath, vision changes, or difficulty speaking, call 911 immediately. This is a hypertensive crisis and requires emergency treatment. If it's extremely elevated but you're not experiencing symptoms, call your doctor's office for guidance. They may want you to come in promptly or may provide other instructions based on your medical history. Do not attempt to rapidly lower blood pressure on your own with extra medications or unproven remedies. Dropping blood pressure too quickly can be dangerous. Your doctor will determine the appropriate course of action. Now, you might be wondering about treatment options if your blood pressure is high. Let me give you an overview, though specific treatment decisions should always be made with your doctor based on your individual situation. For elevated blood pressure and stage 1 hypertension, lifestyle modifications are typically the first approach. These include reducing sodium intake, following a heart-healthy diet like the DASH diet, exercising regularly, maintaining a healthy weight, limiting alcohol, quitting smoking, and managing stress. These changes aren't just preliminary steps before medication, they're powerful interventions in their own right. Research shows that lifestyle modifications can lower systolic blood pressure by 10 to 20 points in some people. That's comparable to medication effects. If lifestyle changes aren't sufficient, or if blood pressure is at stage 2 or higher, medications are typically added. There are several classes of blood pressure medications that work in different ways. ACE inhibitors and ARBs relax blood vessels. Calcium channel blockers prevent calcium from entering heart and blood vessel cells, which relaxes vessels. Diuretics help your body eliminate excess sodium and water. Beta blockers reduce heart rate and the force of heart contractions. Many people need more than one medication to control blood pressure adequately. This is normal and doesn't mean anything is wrong. Different medications work on different mechanisms, and combining them often provides better control than any single drug. Taking medications as prescribed is crucial. Missing doses or stopping medication because you feel fine is dangerous. Remember, high blood pressure usually has no symptoms even when it's causing damage. If you're experiencing side effects from blood pressure medication, don't stop taking it on your own. Talk to your doctor. There are many different medications available, and often an alternative can be found that works well without troublesome side effects.
Before we finish, I want to address blood pressure specifically in older adults because there are some unique considerations. As I mentioned earlier, arteries become stiffer with age. This typically causes systolic pressure to rise. It's very common for adults over 60 to have isolated systolic hypertension. For many years, there was debate about how aggressively to treat high blood pressure in older adults. Some doctors worried that lowering pressure too much might reduce blood flow to vital organs. Recent research, including the important SPRINT trial, has shown that treating high blood pressure in older adults, even those over 75, provides significant benefits. Reducing systolic pressure below 120 in high-risk patients substantially reduced heart attacks, strokes, and death. However, treatment decisions for older adults must be individualized. Factors like other health conditions, medications, risk of falls, and overall life expectancy all influence the appropriate blood pressure target and treatment approach. If you're over 65 and managing blood pressure, have an open conversation with your doctor about your target goal and treatment plan.
Make sure you understand the rationale and that it makes sense for your specific situation. Let me summarize the key points from today. Blood pressure consists of two numbers. Systolic, the top number, measures pressure when your heart beats. Diastolic, the bottom number, measures pressure when your heart rests. Normal blood pressure is below 120/80. Elevated is 120 to 129 with less than 80. High blood pressure stage 1 is 130 to 139/80 to 89. High blood pressure stage 2 is 140 or higher or 90 or higher. Hypertensive crisis is above 180/120. As we age, systolic pressure typically becomes more important, though both numbers matter. High blood pressure usually has no symptoms, but damages the arteries, heart, kidneys, brain, and eyes over time. Accurate home monitoring requires proper technique. Sit correctly, rest beforehand, use the right cuff size, and take multiple readings. Treatment includes lifestyle modifications and often medications. Both are important and effective. If you're on blood pressure medication, take it as prescribed and don't stop without consulting your doctor. Understanding your blood pressure numbers is the foundation of managing your cardiovascular health. These numbers tell a story about what's happening inside your body. When you understand that story, you can take informed action. If you haven't had your blood pressure checked recently, make an appointment to do so. If it's been elevated, take it seriously and work with your doctor on a plan. If it's normal, continue the healthy habits that are keeping it there. Knowledge is power when it comes to your health, and now you know how to understand one of the most fundamental measurements in medicine. If this information was helpful, please share it with someone who might benefit. Understanding blood pressure should be basic health literacy for all of us. In the next video, we'll discuss what happens when you wake up at 3 a.m. and can't get back to sleep. I'll explain the various reasons this happens and what you can actually do about it. Thank you for watching. Take care of your heart, and I'll see you in the next one.